So the topic for today's webinar is, as you can see, health communications in tobacco prevention and cessation. So Emily and I have a lot of information that we're really excited to share with you, and I'm going to let her kick it off.
All right, thank you, Ellen. So health communications, just a basic definition, is the study and use of communication strategies to inform and influence individuals and communities' decisions related to health. And so that's a lot of information in that little section, but I think that graphic there on the screen does a good job of breaking it down even further and just the impact of communications just in all the different facets. So who is going to be affected, like the timing of your messaging, is it understandable, is it accessible, can people access the information? Oh, I think I'm glitching. Am I glitching?
You sound great to me.
So okay, good.
I think we're okay.
Okay. But just the different facets of it there, and that graphic does a good job explaining it, or at least in my head, the way that my brain works for health communications. But really, it has a huge impact, and we'll get into that a little bit more later. We can go to the next slide. All right, so specifically what you're here to learn about today, health communications and tobacco control. So they're essential because they reduce tobacco use and secondhand smoke exposure. They support tobacco control policy and program efforts. They shift social norms around tobacco use. They reduce tobacco-related disparities. They create a return on investment, and they counter the industry's extensive advertising and promotion efforts. And so the graphic on this slide is a great resource. If you haven't accessed it, I highly recommend you do a deep dive into this. It's a little lengthy, so maybe get like a coffee or a tea and settle in for a bit. But it has great resources and just from every angle, just the importance of health communications in tobacco prevention and control. Then there's another resource on this slide. This one's great too, if maybe you've seen it before. But in tobacco control, health communications are sometimes referred to as counter marketing because one of the ultimate goals is to counteract the marketing practices put out by the tobacco industry. So it's important, and we'll get into that in our next slide, because for every penny we spend, Big Tobacco is spending $1.37 in their efforts, and that is a huge, difference. So we need to be strategic with our efforts, our spending, your money. You need to make sure that the messages that you're putting out there are well worth your time, your consumers' time, and they are as effective as possible. So with these limited dollars, how do we maximize the reach? Well, like the examples on the previous two slides, excuse me, you use the existing tools that are out there. So you don't have to start from scratch every time. There's things out there that have been proven, especially in tobacco control. There's data behind it. Use that to your advantage, because starting from scratch can be time extensive, expensive, and so you want to use everything in your toolbox, so to speak, to help get your message out there. Something else that you can do is identify a smaller, well-defined audience and then strategically place ads where those people will see them. For example, if you're able to do that in your schools, you can place ads in the schools, around the youth centers. I believe that's allowed in the Friskies and things like that. Or, just wherever your people will be able to see them, that smaller population. And then, of course, you can coordinate communication efforts with partners and local coalitions to extend that reach. So those are really tied together, because I feel like if you do get a smaller, well-defined population, you can use okay, the joint efforts to, I talk with my hands a lot, um, to reach those people where they are. And that's really good. So um, with that, to reduce media costs, you can go and there's the MCRC, which we'll talk about a little bit later. There are plenty of ads out there that are, available for you, and we'll show you a few of those a little bit later. So when you find an ad that has ran before and you're like, okay, we want to use this again. There's some things that you need to ask yourself before, you recycle that campaign. So first of all, do you have permission to use it? A lot of times you need to make sure that there's like a talent release or things like that. Do you have the rights to use those images? Who do I need permission from? So who put this out there originally? And can you contact them and see if you can use it for yourself? Is there a cost associated with? There's a lot of free options, but there's also a lot of paid options. So before you get into using anything, you want to verify that before you plan your whole campaign around something. Do you have permission to customize it? So that comes into like just even putting your logo on it. There's some materials that you can, there's some materials that you cannot. So it's important to know which version of a file that you have access to. And then, was the campaign even effective in the first place? So if it flopped the first time, you don't want that on your record either. So you want to make sure that it's worth your time and worth all the effort that you're going to put into it. Go to the next one. Yeah. All right. So focus areas for messaging. They should all just focus around changing the norms to prevent initiation. And that's a lot of the work that Jackie does with the youth and all of her work with them. Protecting people from the harms of secondhand smoke. That doesn't go away, I've learned. And then helping tobacco users quit. So these are all overarching themes of tobacco messaging that should be a part of your thought process and when you're planning your media campaigns and health communications. So health communications can be delivered through several strategies, including the ones here on your screen. So first, paid media, and that's paying to place ads on TV, radio, billboards, transit, so like buses or like taxis, things like that, if that's something that's in your area, online platforms, or in print media. Earned media is generating free coverage in the press through public service announcements, press and through public service announcements. And a lot of these can bleed into the next, I've found. So through social media, especially, sharing messages and engaging audience on social network sites like Facebook, Instagram. There's also Twitter, Snapchat, and then TikTok, especially. I've even seen some social media ads for the Truth Initiative on my TikTok, and I've like, that's nice that it's on there. But a lot of these can bleed into the next because you can pay for social media, or you can just put things out there on social media. And so the last little area here is program media, which is delivering messages through a program website and stakeholder communications. So all these are the four main overarching, but there's other activities you all know, like promoting the quit line and reducing or replacing tobacco industry sponsorship and promotions. They're also important to your communication efforts. And the combination of all of these to communicate about specific issues is often called a communications campaign. So I think I said that before previously on one of the other slides. But basically, it's a fancy way of saying all your communication efforts to meet that end goal, those overarching themes of your messaging. And so with all of this, now we'll get into some examples of some campaigns that maybe you've seen before, maybe you're a little bit more familiar with, maybe not. So, Ellen.
Thanks, Emily. That was a great introduction to what we're talking about today and what we're going to look at now. So when Emily and I were talking about everything that we want you all to know about communications, which is so much, we felt that one of the really important things was to talk to you about the things that you're probably already seeing in your communities and that you can take advantage of. So the top example of that you've probably heard us talk about before is the CDC's Tips from Former Smokers campaign. So this campaign has been going around for about 10 years, maybe longer than that. And it is the first federal campaign. So the first one that CDC or anybody did nationally, the federal government did nationally to try to help people quit smoking. I'm sure you have seen them. They are going on right now as well because they only air a few weeks out of the year. But we have two examples here, one from Terry and one from Christine. And they are really exactly what they say they are. They are tips from people who used to smoke. They have historically been a little bit sadder, as you can see now. And there has been a pivot in the past couple of years to make them a little bit more positive. But they have been very, very effective and have helped over 1 million people quit across the country over the past decade. So each year there are some new people who are featured and new stories that are featured, but we can also use stories from previous years. These are free for you all to download and to customize with limitations, which we'll talk about on the next slide. And they are also can be really helpful when it comes to what Emily mentioned about working with partners. So when you can leverage your partnerships, leverage what your coalitions are doing, tips can be really great for that, because if you go to cdc.gov/tips, you can click on the side and there will be resources specifically for people who work in the faith community. So your churches, or people, messages specifically that were recorded by veterans, which you might be able to share with your local VA or veterans from foreign wars or anything like that. So these you will often see, and you might even be seeing them on your TV the past couple of months. An example of what it looks like to customize these is here. This is what Clark County did last year. So they are doing education about secondhand smoke, and you can see that they put their Clark County logo in the bottom right corner. The big thing to know about CDC and Tips from Former Smokers branding is that they don't like to see co-branding, which is when the CDC logo is next to the local health department logo. So as you can see, unlike on these where you can see that blue CDC logo, on this one, there is no CDC logo. It's just the Clark County one. So that is their preference. And so that's what we do in order to be able to use this. You also are not allowed to, change the words or anything like that. And this is a great way to direct people to the quit line. As you can see, it says for free help, call 1-800-QUIT-NOW. So another example of a federal campaign is what the FDA does through their campaign, The Real Cost. So The Real Cost has also been going on for a couple of years, and you may see these ads. I see them on YouTube, but sometimes they're on TV as well. The last ads that we looked at, the tips from former smokers, are mostly around secondhand smoke exposure and quitting smoking. But The Real Cost is more about prevention. So discouraging young people from ever starting smoking. So all of these are ads that were geared toward young people. They are similar to the Tips from Former Smokers campaigns in that you can use them free if you like. If you go to fda.com/therealcost, you can order 50 or 100 posters free, and they will mail them to you, and you can take them to your schools, or the schools can request them themselves. But one of the differences is that there is no co-branding. So these are ones where you're not allowed to put your logo or your school's logo or anything like that on there. You just have to use it as it is. Another national campaign is the Truth Initiative, which Emily mentioned a few minutes ago. Truth is a little bit different because it's not a government entity like CDC and FDA, but they still do national campaigns. So theirs are mostly geared toward youth and young adults, young people. You may have seen their big campaign right now, which is trying to draw attention to the mental health consequences of using nicotine products. So they are billing them as depression sticks right now, things that can increase anxiety and stress and depression. So that's not everything that they do, but that is their current campaign. You may remember a few years ago, I know I did, they did a campaign where they had laid out body bags outside of Big Tobacco Industries headquarters, and they won an award for that ad because it was so striking, showing how many deaths are caused each year by tobacco use. So these also are not customizable, so no co-branding, and you want to make sure that you have permission to use them. So there are lots and lots of organizations out there that do their own media campaigns and their own materials. So I just threw in one other example from American Lung Association. This is one that you may have seen last year, maybe the year before. They did a campaign called Get Your Head Out of the Cloud. So unlike the previous slide, which this was geared toward youth, this one is geared toward parents and other adults, encouraging them to think about how to talk to their kids about vaping and just be aware that their child may be vaping. So they had kind of these ideas like, my kid would never vape. And then they're saying, get your head out of the cloud. And the fine print says more than 5 million American kids vape, maybe even yours. You need to talk to your kid about vaping. So this is another one that was done where, unlike tips from former smokers, you cannot put your own logo on it, but you may be seeing it and it's still spreading a good message in the community. Again, there are tens or hundreds of examples of things like this because there are so many partners that will do their own campaigns. And we just wanted to draw your attention to those. So now we'll transition into something that we have a little bit more to say over in Kentucky, and that is the rescue agency campaigns. KTPC, so Emily's and my organization, has a contract with Rescue Agency where we purchase ads from them. We have been doing this since 2019, and Rescue Agency mostly focuses on prevention campaigns for youth, and that is what we have worked with them on in the past. We may look at cessation, like helping youth quit as well, but right now we're just doing prevention. So they have two kind of brands that they have created. One is Behind the Haze and the other is Down and Dirty. Behind the Haze focuses on vaping. Down and Dirty focuses on all tobacco tobacco use, that is focused more on country teens. And so there are a lot of themes of hunting and fishing and mudding and things like that. So these are also not customizable or shareable because this is a licensed campaign. And when I say that, what I mean is they have these ads that they have already created, that they have tested, that they know are effective. And essentially, we at the state are paying them to run these ads for Kentucky youth. So you may never have seen these, which is a good thing because they're geared toward young people, like not in the workforce young, but your kids may have, or other students that you work with. They focus mainly on social media. So those things might be popping up in their feeds or as ads on TikTok, etc. So this is a really great example of an effective campaign that Kentucky does, is able to provide for youth. But beyond just saying, hi, Rescue, we would like you to please air these ads, we don't have a lot of control over what the actual content looks like other than that we get to approve it. So that is very different from the other campaigns that we do. So many of you all are probably familiar with our Quitters Always Win campaign. This is an example of that. This is a kind of campaign where, unlike Rescue Agency, which was licensed and we just said, yes, we like that, please run it in Kentucky. This, we worked with a media firm to design from scratch. We were able to work with the designers to work on the fonts and the verbiage and everything about what it looks like. And then we own the final product. So this is an example of, I think it's a mock-up of a billboard that was done. This also is the same as our magnets that you may have seen, our business cards that you may have seen, etc. It was a cessation campaign, so it was everything promoting 1-800-QUIT-NOW and Quit Now Kentucky. But this is customizable, which we're really excited about. So like I said, we at KTPC do own this design, this campaign. And so we can tweak it to be what you need if you just reach out to us and let us know. And there's no cost to that. It really just depends on how much time Emily and I have to customize something for you. So an example of a customization is this example right here. So Montgomery County reached out to us. I think this was before COVID, so maybe in 2019. And they said, we need a banner for our baseball field. And so we took this design that already existed, I resized it to make it the right size, and then we added the Montgomery County Health Department logo. So if this is ever something that you're interested in, if you need a billboard, a banner for your baseball field, anything like that, you can just reach out to Emily or me, and we can work with you to see if we already have something that exists that you can just download, or whether we can work with you to create something. That was the campaign that we did in 2017. And then we did a new campaign in 2019, and it went so well that we ran it again in 2022. So this is a similar situation where we worked with a media company. They designed this for us. It is another cessation campaign promoting Quit Now Kentucky. And it is another one that health departments can use free. The only difference is it's not customizable. So we're not able to add logos or change the text or anything. But these are ones that you may have seen in your community. This is an example from a gas station in, I believe, Shelbyville. And the message is you're under a lot of pressure to not smoke around others. Now you have resources. So all of the messaging here with these characters from the 2019 and 2021 campaign are all very positive. This idea that we're not here to judge you. We already know that you have your reasons, which is why the name of the campaign is You Don't Need More Reasons. But we'll help you actually find a way. So we know you have the motivation and you just need help. And that's what we can provide through 1-800-QUIT-NOW. So as much as I said these are not customizable, we have done a little bit of customization with size on these. An example of that would be WEDCO Health Department reached out and asked about getting window clings, and I think we didn't have those, so we worked with them to make something that was the right size, because if we were, for example, to shrink this poster down to a window cling size, you wouldn't be able to read any of it. So there's a little bit we can do, but we can't add branding to these. Do you see something? The Q&A? Yes, okay, I will answer that question later. Okay, and then our most recent campaign that you may have seen us do from KTPC is our My Life, My Quit campaign, which I think you all already know about. This was included in the school toolkit that we sent out last year. So every school in the country, not in the country, I'm sorry, in the state that serves 6th grade and older got 12 posters with this design. So like I said, we created this campaign with a media company last year in 2021. It's also not customizable like the previous one, so we cannot add your logo, but you can get these free and use them. Like I said, every school did receive some. And then there were also ads, for example, in gas stations that I hope you saw, and some other places in the community. So this is an example of where this, and the past two are examples of where KTPC is spending some of its media dollars. So when we get funding to do a campaign, we're looking at things like this that go statewide. And so we just had a question in the chat about how to get some of these materials. And the answer is right here. We do have a Google form online where you can request these. We have many, many more than what I've shown you here. As you can see on the right-hand side, there are two examples. On the bottom, you have business cards or referral cards that you can get for My Life, My Quit. And at the top, you have an example of, it's like a notepad that doctors can use. It's similar to a prescription pad that has Quit Now Kentucky information on one side and My Life, My Quit information on the other. Other things that are available through this form are posters, fact sheets, magnets, etc. So we have lots of things that we are absolutely happy to mail to you at no cost. The only little caveat there is it is first come, first serve. So occasionally we do run out and you'll have to wait, or we may decide not to reprint something because it's too expensive or it wasn't as popular. So we will try to get it for you if we can. And then if demand is really high, or if you want a large number of things, like you're like, we love this poster and we want 10,000 copies of it. I'm probably going to go, okay, here's the file. You can take it to your own printer. We would still love for you to do that, but we can't afford to print you 10,000 copies. So we would ask you to use your own budget dollars to get it printed. But generally, you can always ask, you can always put in a request. And if it's something that we're not able to fill, we will reach out to you and let you know what some other options are.
And I will say, I include that link in our monthly newsletter, our monthly memo. So if you don't just want to write that down real quick, it is included in our monthly newsletter.
That is a great point. Thank you. And I'm also planning to share all of the slides and all of the links that you're seeing in an email after this. All right, so that is sort of the end of what we at KTPC do directly, but we have lots of other resources that are available to you specific to Kentucky and that you might see out in the community. So one example of that is the Kentucky Center for Smoke-Free Policy, KCSP. I hope you know them and love them as much as we do already, but if not, they're definitely a wonderful organization to work with. They're based out of the University of Kentucky, and their focus is smoke-free policy. So if you are in a community that already has a smoke-free policy that says that people cannot smoke in indoor workplaces, you can work with them on enforcement. And if you don't have a policy, they would be happy to give you some education tools to be able to do that. One example of that is what you're seeing here on the right-hand side. They have a couple of different mock-up materials that you can customize and use. The beauty of these materials is that they are all message tested. And so they worked with groups and tested this language to make sure that when people read it or they see it, they understand what we're talking about. So this is where one of the concepts that we came up with, or that they came up with that we promote, came from, and that is that it's not about the smoker, it's about the smoke. So the idea of doing a campaign that is not pitting non-smokers against smokers, but is really just saying, hey, we're just worried about the secondhand smoke. We're just worried about the actual smoke, not the smoker themselves. So this is available at KCSP's website, as well as other versions. There are billboard shapes, push cards, all kinds of different things that you can customize, because as you can see at the bottom, it has information for partner info and partner logos. So this link will also be shared in the follow-up email that I send. Another example of something that our partners have created are these campaigns by National Jewish Health. So National Jewish is the organization that runs our quit line for us. And they found that across the country, there were people who wanted help promoting the quit line to people who are LGBTQ, Latinx or Hispanic, and people with behavioral health conditions. So they created these ads, and we tweak the little language at the bottom to make sure that it was referencing Quit Now Kentucky. And this is all available for you to use now. So you see here one example of a poster or a flyer that you can download from our Google Drive on the right. But then there's also this message in Spanish that is actually just an ad that you can put, for example, on your website or on another website that you may work with Google Ads or another group to get posted. And if you were to click on that ad, then it could take you to the Quit Line or the Quit Line Spanish site. Right, so other places where you might see tobacco messaging or tobacco counter messaging in the community are not always coming from us, but maybe coming from other partners. So an example of that would be these signs about how the legal age to sell tobacco products, to buy tobacco products is now 21 in Kentucky and federally. So the Sign Our program, which is part of the Department for Behavioral Health, printed these or got these made and had them put up in gas stations. So you will often see messages from FDA, from the SINAR program, et cetera, in places that sell tobacco products. So these are not customizable because they've already been printed, they're already there. But we are very grateful for that partnership because in addition to getting the message out about youth not buying tobacco products, they also included our 1-800-QUIT-NOW information at the bottom, which we really appreciated. But just because they are doing this retailer outreach doesn't mean that you can't also do retailer outreach. So you may want to do something like put up posters for the Quit line or prevention posters in your local gas stations or other tobacco retailers if you have permission from them. So don't be afraid to reach out to someone just because they already have messages out there. And then another example of places where you may see things are like the Grocers Association magazine and other magazines like magazine, MD Update. I guess it's a magazine. Sorry. I need more coffee this morning, but you can see here 2 examples that KTPC has done to either promote the Quit line, as you see on the right, and that was to promote it to doctors and nurses and healthcare providers, or to promote something else like the Trust program, which educates retailers about not selling to youth. And that's an example of an ad that was in the Grocers Association magazine, which I always can't resist to tell people. The Kentucky Grocers Association magazine is called Check Us Out, which I think is the best play on words ever. I just love it. So with that, I'm going to turn it back over to Emily to talk about MCRC.
Yes, so I mentioned this earlier when I was talking about don't reinvent the wheel. There's a lot of free and low cost tobacco education materials available to you through the Media Campaign Resource Center. And so you do have to have an account because you will have to put things in a cart and then request them, but it is free to have an account. And you can use these to help all of your tobacco control efforts. So you can just type in a word. There's a search bar if you're looking for something specific, like for a specific population, which I have some examples, I think, on the next slide. But LGBTQ, they have a whole toolkit full of things. And when I say toolkit, it's like a package of just like 50 some images that you can use. Yes, here we go. But it's very cool to just go in there and look around. That's one of the first things I did once I got access to it, just because there's so many. So there's, a tips campaign, like I'm trying to think of, I think it's called a package, a tips campaign package. So you download it and I think it downloads as a zip file. But there's just so many different options for Facebook posts, for Twitter posts, the different dimensions that you need for those specific platforms. There's a mother's toolkit. There's a handful of secondhand smoke infographics. I've used them on our social media if you keep up with us on there. And then there's other examples from other programs. Something that I learned recently, they give a 101, 102 sporadically for the MCRC, just like an introduction of here's how to use this resource. And whenever that becomes available, we'll be sure to share it because it is a great, just walk through versus trying to figure out things on your own. They point out things that to them probably seem obvious, but to me, it was nice to actually get instruction on. So maybe you're like me and you need something like that too. But there are some, you can see on there, free or low cost tobacco. Some materials do cost money. A lot of them don't, but some of them do. And I was kind of afraid to reach out and do some of those things before, but now that, I've had this 102 lesson, it seems a little bit easier, but so that was very nice to learn. And then there's also ads that are in cycle. So Ella mentioned that with the tips campaign. Some ads will be in cycle, and so they're on air, they're being ran during a certain amount of time. And so those can usually be used with no additional cost during a certain amount of time. So That's good to know. So we already talked about the different packages that you can get. And they're just great to use around, Mother's Day or other holidays. There's one in the LGBTQ package that's for Best Friends Day. So we use that for Best Friends Day this year. And you can use these to suit your needs. You can't customize a lot of the ones that are in the package, but you are able to use them, anytime for any reason. So that's good to know. All right, back to you, Ellen, I think.
Okay. So as Emily mentioned at the beginning of the presentation, there are 4 different categories that media can fall in. And one that we haven't really talked about is earned media. So you want to make sure that you all don't forget that one for many reasons, but one of which is that earned media is usually your free option. So that is when you're getting other people to pick up on the messages that you're already sending out. So I have 2 examples here. One is with the University of Kentucky and our partners at KCSP, who I just mentioned, did for our conference. And so in addition to actually having the conference, having the award ceremony that came as part of the conference, they also put out a press release. So if you are doing anything, it doesn't have to be a conference, it doesn't have to be a big splashy thing. It can be as simple as offering a new freedom from smoking class. Then you can put it on social media and advertise it the ways that you traditionally would. But you can also write out the little press release and send it to your local stations, and they might decide to write an article about it. That's especially true if it's something around Great American Smokeout or Heart Health Month or something like that. Then that gives them an extra thing, especially if you have a smaller local news or, for example, newspaper like I do in Maysville. They're often looking for content like that. So they might pick up your press release and say, okay, we're going to interview some people and turn it into an article. And then this is a little blurry on the right, but this is an example of when we launched My Life, My Quit. We put out a press release, and then the media came and interviewed Elizabeth and Heather there, who you can barely see through the pixels. And so that was an example of earned media, was getting that talked about on the news. But then also by taking pictures of them getting interviewed, I was able to put something on Twitter. So it really was like a waterfall effect or domino effect of getting more and more conversation happening about the launch of My Life, My Quit. So I have 2 more examples here, and these are from the Smoke-Free Partnership of Mason County, which many of you all know is my hometown and where we're coming from, where these are coming from. So one example on the right is on the left is we got a quote from one of our coalition members, and instead of just putting it on Facebook as a caption or as a post, we said, okay, well, let's get a picture of her and her child, and we can put the quote on the picture and then post it like that. And that face is more engaging for people, and people want to see a picture of, somebody happy with their child, and then they're more likely to read the message. And another example is a letter to the editor. Anytime you have a coalition member or a community member, whether it's a doctor or somebody who's trying to quit smoking, anybody who will write a letter to the editor for your local paper, that's fantastic. That's additional conversation. Here's an example here. And you can take pieces of that, like if there's a sentence in there that you find particularly thought-provoking, then you can add that to your social media and make a social media graphic out of that as well. Those are my earned media examples.
All right, so here are some elements of effective messages. So just some things to keep in mind here. So you can state the issue with credible facts. So secondhand smoke contains nearly 70 chemicals that cause cancer. All right, facts, straightforward. It can evoke a shared value. So everyone has the right to breathe clean air. Well, yes, everyone does have the right to breathe clean air. And then give a call to action. So protect loved ones from secondhand smoke. So putting a little bit more behind the messaging that you're putting out there. So if you are going to design your own materials, it's important to keep in mind that you need to be sensitive to other public health issues going on at the time, and like any specific populations that might be affected by it. But it's important to remember your call to action. Use a simple message. Don't make it too complicated. You are allowed to leave blank space on a page. It's allowed. And then know your audience specifically. So if you do hone into a specific audience, make sure that you're meeting them in an appropriate way. And then, of course, you can ask us for help at KTPC.
And then we also have some don'ts on this slide, which I will take over. And I'll start by saying I'm going to break my own rule here. So one of the things that I have here, to skip straight to, don't repeat myths. You're also not supposed to repeat don'ts, but I'm doing it, which is why I cross these out. But there's something called the familiarity backfire effect, which basically says that the more often somebody hears a message, the easier it is to process, the faster they absorb it, and then the more likely they are to think that it's true. So when you repeat myths or repeat don'ts, repeat bad things, then people think, oh, I've heard that before. And then somewhere in their brain, they start to think of it as true. So an example of this might be if you see an ad that says like, myth, vaping is safe. And then it's like, fact, like vaping is not safe. Well, but you just repeated the myth that vaping is safe and people are absorbing that. And now 2 weeks from now, they might be like, I think vaping is safe. So we try to avoid repeating myths at all costs. And one way that you could do that is just by when you can still use the same concept for that ad, but your language can just straight out say vaping is dangerous or vaping is not safe, period. You can skip the whole myth. So that is our bit about repeating myths and repeating don'ts, which I'm doing right now. Another thing not to do, if I go back to the one I skipped, says don't blame or shame tobacco users. So anything that you do that makes them feel bad or makes them feel as though that they are the cause of their own smoking related problems, or that people don't like them for being smokers, like smokers smell bad, things like that. That's not helpful. Really, the only negative messaging that we do is prevention, to try to illustrate to people why not to start smoking. And then obviously the Tips from Former Smokers campaigns do illustrate reasons to quit. But beyond that, we really try to send positive messages that quitting is possible and that we have free help to offer. So those are the first two. The next one, the next don't is don't include smoking cues. And a smoking cue would be anything that visually reminds somebody of smoking. So that would be like an ashtray, a cigarette, a lighter, a cigarette butt, things like that. Again, we can use these in prevention messaging, but when you use them in cessation messaging or messaging that's trying to help people quit, if you are a non-smoker and you see an ashtray with cigarettes in it, you're like, ew, gross. If you are addicted to nicotine and you've been a smoker for many years and you see a picture of an ashtray with cigarette butts in it, you're like, I want a cigarette. And so we call that a smoking cue, because when somebody who smokes visually sees it, then it reminds them of smoking, and it usually makes them want to smoke more. So we avoid those in pretty much all messaging. Examples of when we would use it might be if we were going to do a message about pollution, that we might, still use cigarette butt images. But anytime that we're encouraging people not to smoke, we don't use smoking cues. And then the last don't is don't use copyrighted images. And so I have another slide about this, about if you're not using copyrighted images, how do you know if it's copyrighted and what can you use? So there are generally three kinds of images that you can use. Those are images in the public domain, images that you took yourself. If you took it yourself, you know you own it, or images that you have purchased. So you can buy stock photos online. When we're talking about images in the public domain, those would be ones that are available through either they're not copyrighted, they were published before 1923, or they are have a Creative Commons license. So one of the ways that you can try to figure out if something is in the public domain and if it's free to use is by reverse Google image searching to try to figure out where it originally came from. And there are some other tricks that I can email out when I send you all the links to these items. But I also included this graphic called "Can I Use That Picture?" which I think is very helpful. And it kind of gives a flow chart that I don't expect you to be able to read at this point, but when I send out the slides later, you might be able to check it out. And the big thing here is, do you have permission from the original creator, or is it part of the public domain? As I said, there is some leeway for educational purposes. So if it's something that was intended to be openly viewed by the public for informational purposes, and you are also using it for the same purpose, you're usually okay, but it's better to be safe than sorry and to do your research. So back to you, Emily.
Yeah, so if we haven't totally overwhelmed you yet, or maybe we have, you're not sure where to start, don't panic, we're here for you. So you can reach out. I think our contact information is on the last slide, but we're also on Facebook and Twitter and Instagram. If you want to see some of the work that we've put out there, maybe it'll inspire you. Maybe you want to steal it. It's fine because it is free to use if we've used it. So go out there and get inspired. And there's also CDC Tobacco Free on Instagram. They're on Instagram, Twitter, and Facebook. And they have a lot of good posts that they just put out sporadically, and their types of messaging range throughout the month. So if anyone has some extra time to spend on Facebook or Twitter, you can go out there and get inspired pretty quick. So overall, hopefully you've learned that communication is a powerful tool. Health communications can prevent tobacco use, promote cessation, and shape social norms, ultimately countering the tobacco industry's extensive advertising and promotion efforts. So hopefully you've learned the value of our small but mighty efforts comparatively, and why you need to put the time into making those messages effective and worthwhile. So, Ellen, do you have anything else?
Great. Thank you. No, I don't have anything else to add. So I would love to use this time for any questions that you all have. And I will also say, before we get into questions, I don't want to forget, we really appreciate if you all will evaluate this presentation for us. So I think Heather is going to put the link to evaluate this in the chat. It's really short and sweet. Oh, there you go. It's really short and sweet. It's like 4 or 5 questions just to let us know if this was helpful, how it could have been more helpful, and future topics you might like to hear. So while you're filling that out, or while you're thinking about that, what questions do you all have? And you can raise your hand, you can put it in the chat, you can put it in the Q&A. I'm going to guess or hope that maybe some of you all are typing questions, or maybe we've already answered everything you wanted to say. There was a question in the Q&A a little bit ago where Tara had asked if we could send information about the material this is printed on and how to get things like this printed. So there are a couple of ways that I could interpret that. I think we talked about one, which is just you can email us and we will send you the file. But when I reread that, I think Tara might have been asking about, like, how do you get posters put up in bathroom ads or bathroom stalls in Shelbyville when you're in Frankfurt. And we had a conversation with another health department about this a few weeks ago. We work through a company that just specializes in getting ads out. So they will print their stack of posters or their window clings or whatever it is that they're going to be putting out into the community. And they pay their people to go drive around and put them up. And they have contracts, I believe, with those gas stations or schools or whomever it may be. So it's thank goodness it's not Emily and me driving all around the state begging gas station owners to let us put up our flyers. There is a company that specializes in that, does that full time, and we have contracts with them. So we are happy if that's something that you're interested in. We are happy to let you know who we have worked with, but we are not the experts. This is something that we found it valuable to outsource for somebody else to do.
I will go ahead and plug our newsletter again, our monthly memo. I'm trying to get my computer to cooperate enough to put the subscription link in the chat. But if you have not already subscribed to our monthly memo, we did transition when I came on board to MailChimp. So via their permissions, you do have to sign up for it again. So we appreciate your participation in that if you would like to receive that from us. So I will find that and put it in the chat, and then we'll send it out with the information afterwards as well.
That's a great point, Emily. So one of the big ways that we get this information out is by through the monthly memo, through letting you all know. But because we changed the platform, it may be going to your spam. It may be going all kinds of places. So if you're not getting the monthly memo, please let us know, and we will work with you to help that. Maybe it's because you're new or you somehow got missed off of our list. We'd be happy to add you. Maybe it's because you are in the list and we just need to talk you through getting it approved through that spam filter. But definitely tons of awesome information in the monthly memo. Thanks to Emily. So we want to make sure that you're getting that.